Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, April 15th, 2021. And our top stories today, fitness or fatness, which is more important? And we'll take a look at statins. Well, joining me now to discuss this and a lot more is Dr. Michael Blaha. He's Director of Clinical Research at the Ciccarone Center for the Prevention of Cardiovascular Disease at Johns Hopkins Medicine. Dr. Blaha, great to see you. Thanks so much for joining us on the program this morning.
Yeah, my pleasure.
So let's talk about fitness versus fatness. And is one more important than the other, or is it, as I would think, a balancing act?
Yeah, this is a great scientific debate, the fitness versus fatness debate. People are debating this all the time. And they go together, of course. Generally speaking, people who are more fit are less fat, but that's always not the case. So this is where the literature has started to investigate which is more important. And I would posit that the more important one of these is actually your fitness level. Your fitness level is more important in some ways than your fatness level. And what I mean by that is if you're a little overweight, for example, but you're fit, you actually have pretty good outcomes. Your survival and your cardiovascular disease outcomes are favorable. If your normal weight would have very poor fitness level, actually your prognosis is not so good. So it's really more important to kind of strive to achieve fitness. Well, of course, while also managing your weight, but fitness is more important.
Michael, when it comes to heart health, are there rules of thumb? I mean, we're talking about doing more cardio. I know the last time we had you on, we talked about cardio versus weightlifting, and a combination probably makes a lot of sense. You're the expert here, so tell me if I'm wrong. But does it make sense to do, get on that Stairmaster, or get on the rowing machine, or take a nice walk? What types of activities do you have to do to generate the right fitness for your heart, your cardiovascular system?
What I like to tell my patients is you want to do something where you break a sweat. People always ask me kind of what level of activity do I need to kind of improve my fitness? And that's my general first take. You have to break a sweat. That could be via brisk walking, hiking, running, jogging, a lot of different activities. But if you're just walking around, around the block, maybe in a social way, don't really break a sweat, I'm not sure that's really going to help your fitness that much. So I think you need to get up to the point where you break a sweat. That's a rough rule of thumb. And people always say to me, well, I've been exercising, but I'm not losing any weight. What I say to them is, well, do you feel like you can exercise more? Well, yes. Is your exercise capacity improving? Yes. Well, your fitness is improving, and sometimes the weight lags behind that. So sometimes you can be doing a lot of good for your body by improving your fitness before your fatness gets better. That's one of the key messages here. So even if you're not losing that weight, but you're doing that exercise, you're improving your overall health.
And as we talked about last time you were on the program, it's looking at some of the markers, right? I mean, you've got, when I go to my internist, it's the cholesterol, the lipids, the triglycerides. This is obviously not my expertise, but these are things that you would gauge your overall body health. And I would assume that you'd want to check those against your weight, also against your fitness level.
Yeah. So what's going to happen? This is really important. So let's say you're a little overweight or obese and your fitness is not so good. And you start an exercise program and you start to exercise more. You start to improve your exercise capacity, but your weight hasn't changed yet. You might think this isn't working, but I can guarantee you if you check, and we've done research on this, check things like your triglycerides, as you mentioned, the inflammation level in the body, those are going to be improving even before the weight improves. That speaks to why fitness is so important. You're doing great things for your body in a metabolic way, even before the weight changes. Now, you might see your weight redistribute. That's one of the most important things, right? You start to see your waist size get smaller even before there's big changes on the scale, right? Because you're going to lose that weight preferentially in your abdomen and that visceral fat that we think is the worst for you. So those early changes where your fitness is getting better, you might be losing a little bit around the waist, but only a couple pounds on the scale. If you checked a bunch of these other metrics, as you mentioned, the triglycerides, the inflammation levels, things, diabetes, sugar levels, those are all going to be getting a lot better in concordance with the fitness changes. So yes,
Yeah.
a lot's going on in the body, even before you lose weight.
Sorry, I didn't mean to interrupt you. What about how do you measure your fatness? I mean, a lot of it is the waist size. You pull on pair of pants or your skirt, and you know whether or not it fits or not, how comfortable it is. But there are scales like the BMI, right? That are those still good arbiters of what is quote unquote fatness?
Yeah, it's a good question. So there's a lot of debate in the literature about this too. Now, it turns out the best marker of your metabolic health as far as your body size is actually the waist circumference, as you mentioned. It's the fat, it's the weight, the tissue that we put around our waist, particularly as men, but also as women, inside the abdominal cavity, that's the worst for you. It causes the most problems compared to a little fat in your arms, for example, or around your shoulders. So it's actually the waist circumference that's the best. Now, getting on the scale and just measuring your weight, that's a good start too. But I tell my patients not to overemphasize that, because that's going to be a lagging indicator of the benefit. But if you notice the little looseness of your pants around your waist, you just feel a little bit better there. That's the start of the process. You're starting to lose some of that kind of the most high risk fat. So yeah, the BMI is a nice thing. There's some other fancy ways of measuring these things, but just a simple kind of tape measure, or just your pants around the waist, or even just, you can tell just by putting your hands on your waist. That is a great indicator that things are starting to change.
Yeah, and lastly for this segment, this all is you're advocating for fitness, making sure that you're doing some level of fitness to improve your heart health, but this is also balanced against a healthy diet. And a healthy diet doesn't mean that you can't cheat and go to Baskin-Robbins or some other ice cream facility to have a little bit of something extra on the side.
Yeah, of course, with diet, like everything, it's in moderation, right? I never tell my patients that you can't have this or you can't have that. There's no one food that's perfect. There's no one day that you can't splurge. It's about being consistent 365 days a year with a general diet pattern that's favorable, and you'll have good outcomes. So yeah, what I would summarize kind of the big things from this section that we just did was how important it is to achieve fitness, that just because you're a normal weight doesn't mean you're fit, right? You can actually be overweight and fit, and that's better than having low fitness. So you need to separate those in your mind. There's fitness and there's fatness. Fitness is more important. Fitness is important, even if you're starting to lose just a little bit of fat around the waist, really important. And then, yeah, diet, be consistent, something that you can stick with. When a patient says to me, I'm on a 30-day strict diet where I'm not having all my favorite foods, I'm a little worried because they're probably not going to stick with that. So something that you can stick with, 1 day a week, splurging maybe, fine.
Yeah, it's early in the morning, but I can think about some Baskin-Robbins, maybe some cookies and cream right now. Well, Dr. Blaha, I want to take a quick break. When we come back, we'll talk about statins. Should you be taking a statin? And what are the side effects of statins? You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking to Dr. Michael Blaha of the Ciccarone Center for the Prevention of Cardiovascular Disease at Johns Hopkins Medicine. Michael, thanks for staying with us this morning.
Of course, my pleasure.
Let's shift gears. Let's talk about statins and their prominence, their importance in maintaining heart health. First, what is a statin?
Yeah, statins are pretty much one of the most researched drugs that we have now, and really one of the most effective. They're game changers for cardiovascular disease. So a statin is an oral drug. You take it every day. And what it does is it reduces the production of cholesterol in the liver. And it causes your liver then to take up some of the cholesterol in your body and take it away from things like your arteries so it can use it. So it works on the liver by reducing the production of cholesterol. That's the way the statin works.
And who is a good case for a statin? Is it someone who has tried to moderate their behavior with fitness, exercise, diet, other health remedies, but still not able to kind of get their cholesterol down? Is that the right candidate for this type of drug?
Yeah, so great question. So yeah, what a statin does, of course, is it lowers your cholesterol. And it can lower your cholesterol, your bad LDL cholesterol, up to 50% or more. So this is really more than what you can see actually with diet and exercise. But it always comes after diet and exercise, right? We try to control diet and exercise first. And if your cardiovascular risk isn't well controlled, the statin is always the next best option to control cardiovascular risk because it's so well researched, so safe, and so effective, lowering that LDL cholesterol up to 50% or more on top of diet and exercise. Yeah, so the best people that are candidates for this are pretty simple. You have really, really high cholesterol, you're high cardiovascular risk or already have had a cardiovascular event, or have a particular condition like diabetes where we think patients particularly are benefit from the statin. So very high cholesterol, particularly with a family history, high cardiovascular risk where you already had a cardiovascular event like a heart attack or stroke, or diabetes. Those are the groups.
Does age play a role in this? I mean, can you see somebody who is a younger person, maybe in their 20s, early to mid 20s, or someone, a little bit more mature in their 50s, 60s, 70s on the drugs?
Yeah, really, all the above. So, but the younger you are, the more we'd like to emphasize lifestyle, right? Because we can make those changes that last a lifetime. So if you're in your 30s, have a family history, but are not exercising, not eating a good diet, or overweight, absolutely, we're going to work on your weight and your exercise first. As people age, their risk starts to go up, and we start to consider a statin more carefully. So typically, when we're treating young patients with statins, there's the patients who have very, very high cholesterols that can't be fully controlled with diet and exercise. Once you reach middle age, though, that's where we start to say, what is your cardiovascular risk status, and do you need to be supplementing diet and exercise with a drug like a statin, which is generic, cheap, well-tolerated, and can lower your LDL cholesterol a lot, and has been shown in multiple, talking about 10 or 20 clinical trials to lower the risk of heart attack or stroke in direct proportion to the amount of cholesterol lowering.
Michael, when it comes to these statins, are there things that a patient should be aware of that their doctor would advise them about in terms of side effects? I mean, we talked about in the first segment, no food is perfect. No drug is absolutely perfect, I would think. Are the things that we need to be focused on when we're taking these medications?
Yeah. Yeah, so statins are very well tolerated for the most part. I mean, in probably 30 or 40 million Americans take statins, something like that. And most of them tolerate statins perfectly well. Maybe about 5 to 10% of patients can have side effects or symptoms from a statin. Now, sometimes it's hard to sort out whether it's really attributable to a statin or not, but some patients can experience some muscle pains with a statin, and some patients can experience a slight rise in their blood sugar levels with the statin. Now, I will say, in randomized trials, when patients are blinded to what drug they're taking, they actually don't have that many more symptoms on the statins than on the placebo. But in the real world, you're going to find patients who get some side effects with statins. Now, what we've shown is that if you work with the patient, you can get most patients to stay on a statin long-term, at maybe at a small lower dose or a different statin. So the amount of patients who can actually take a statin who try it are probably like 90 to 95% or more of patients can stick on it without any problem whatsoever.
When you look at, your organization, the Ciccarone Center is doing a lot of research on preventative, treating cardiovascular disease and preventative. What types of drugs, we've got these great statins, we all know the brand names, the Lipitors, the Crestors, they're, as you mentioned, there's generics now. But what are some of the drugs or the treatments of the future what do they look like? And what should we expect in the next 5, 10, 15 years of treatment in this area?
Yeah, well, that's a great question. There's a lot of great drugs coming down the pipeline, particularly exciting drugs to control weight. For some of the most effective obesity drugs are coming down the pipeline. We have drugs that treat diabetes and make bring people off insulin and lower their cardiovascular risk. But I'll take a step back and say, actually, what we really need, even more than new drugs right now, is to get people on the drugs that we already have that work. In particular, statins, because we have a lot of patients who would benefit from taking a statin who aren't taking a statin. So it's funny, while we do need new drugs, what we really need is a better tools to get people on, the right people on things like statins. So there's a lot of research on things like, coronary calcium scans or other tests to figure out if you have early plaque in your arteries. If you have early plaque in your arteries, you really need to be taking a statin to kind of lower your risk, or ways of characterizing your cholesterol in new ways to figure out who's most likely to benefit from a statin. So we're at that interesting part of drug development where we're getting new drugs, and some of those drugs are for particular less common problems. But the most important thing is finding just everyday people out there who are at elevated cardiovascular risk, who might want to start a statin and take it long-term and get tremendous benefit just from a simple generic, in some cases, $4 a month drug. So we just want patients kind of asking questions about statins. Do they need to be on a statin? Asking their physician if they need to be on a statin, maybe doing some tests to figure out what their cardiovascular risk is, in conjunction with kind of taking our highest risk patients and getting them on some of these new innovative drugs too.
And part of this is being, going to your doctor on a regular basis, right? I mean, there are still people, I would presume that if people aren't treating these diseases, it's maybe because either they, sometimes there's denial. Oh, I don't have that. I'm going to do what I can. Or they maybe haven't gone to a practitioner and research maybe why they are having symptoms, or getting their blood work done on an annual basis. Many insurance programs, Michael, cover an annual physical, right, which has basic blood work like LDL, HDL, triglycerides, and other markers.
You're absolutely right. There's an enormous amount of people out there, unfortunately, who do not know their cholesterol. There's a lot of people out there who are sort of, like you mentioned, in denial, waiting for symptoms. Well, it's hard to prevent something when you already have the symptoms of it. So you need to start earlier. Who don't have a primary care doctor, who've never had this discussion about statins, or unfortunately nowadays also suffering from some degree of misinformation about statins too. There's some discussion out there that statins are, harmful, that cause things like cancer, things they do not. They do not cause cancer. And getting through that misinformation, speaking to a primary care doctor or cardiologist or endocrinologist or family practice doctor of any sort is a great way of just getting through some of the noise around statins and really getting at kind of who should be on it, should you be on it, and why, and then and realizing the benefits. So it's really important, just to have that conversation with a practitioner that you trust and figure out if you need to be on one of these drugs, because we know if you take a statin, you need to take a statin, and you take it long term, you can lower your risk, tremendously, up to accruing over time, 50% reductions in heart attacks or strokes, which can make lifelong impact. We know that statins even can lower the risk of dementia and things in the long term by reducing things like mini strokes. So they can have benefits that last a lifetime.
Yeah, well, as you were talking about this, we were talking about the cholesterol numbers. I was thinking about an ad campaign for retirement that said, "What's your number?" And it was referring to what's your number that you need to retire. Maybe we need a number around what's your number when it comes to cholesterol. And you walk around in the commercials about, "Hey, what's your number?" "Oh, I'm 200 or I'm 150, that kind of thing. Anyway, just an idea. Hopefully there's some ad execs out there listening.
Yeah, know your cholesterol level, know your blood pressure too. You have to know those things because there's a number of people, even if you seem like you're healthy, who might have genetically high cholesterol or high blood pressure. They just need to know that and get on top of it early.
Yeah. Well, Dr. Michael Blaha, Michael, it is great to see you. Thanks so much for joining us, and thanks for sharing a little bit of your expertise this morning on the network.
Yeah, my pleasure. Thanks a lot.
And that wraps up this episode of BRN AM. Have a topic of interest or someone you think we should talk to, then drop us a line. And don't forget, for all the information in retirement markets, technology, personal finance, so much more, check out today's edition of our daily newsletter, The Morning Pulse, and of course, our website. We're back again tomorrow, so until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.